This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Thursday, July 16th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. We begin our coverage in South Africa, where COVID-19 infections are climbing and hospitals are turning away hundreds of people infected with coronavirus because of a lack of medical staff and equipment. One intensive care unit at Port Elizabeth has been able to accept only 25% of the people seeking treatment, according to Dr. Tobisa Fodo. Fodo says, quote, "It's heartbreaking in the sense that you end up yourself and your team having to say no to somebody's mother, somebody's grandmother, somebody's father, somebody's uncle. Scores of people are dying across South Africa without getting medical treatment. South Africa has more than 311,000 coronavirus cases and more than 4,400 deaths, according to Johns Hopkins University. The COVID-19 lockdown in South Africa, the country worst hit by the virus on the continent, is raising worries about worsening child malnutrition. The malnutrition of children has long been a problem in the country, but measures to control the pandemic is cutting off some of the vulnerable from government food programs. Franco Puglisi reports from Johannesburg.
The COVID-19 pandemic is intensifying the inadequacies of South Africa's food distribution systems. But securing enough food to survive is simply not enough to overcome hunger and malnutrition, says experts. It is also about what people, especially children, eat and whether it is nutritious.
Over 400,000 children in that age cohort category not having access to food. So the food insecurity, and if we just look at adequate nutrition and support of children, is definitely a grave situation, a situation that requires urgent attention.
Nutritious food for children is a priority for their growth, but the coronavirus lockdown has disrupted distribution.
With children not being able to go to school, a lot of children have been deprived of the opportunity of having access to food. And during the lockdown period, what we have also found that many people have not been able to secure an income, to generate any form of income. People both within the formal sector and informal sector have suffered, I think, enormously as a result of this.
Julia Moyo struggles to provide food for her children.
Okay, no hona batho ba re thusang, ne re thusa ke koko ne no hlokafetse like last week ke no ne re thusa ka bo dijo. Ha ona government ore council re thusang. Ona le mathata go ntlong ka bana no because re struggle like haholo ka dijo. Papa bona sebetsa le iwane. Le nna ke sebetse ke nana kona bothata ba bona.
Between 1/4 to 1/3 of children are stunted or too thin, according to the World Food Programme.
Children are not consuming enough food with the right nutrients that are needed for their growth. Is the immediate cause of malnutrition in children. In infants and older children, it is due to poor infant feeding practices, wherein you find that most of the children are either not breastfed. And we need to remember that the greatest burden of all forms of malnutrition is shouldered by children from the poorest and most marginalized communities.
As the pandemic persists and more children go hungry and suffer from malnutrition, achieving the goal zero hunger in the years to come is seriously in doubt. Franco Puglisi report for VOA News, Johannesburg.
The World Health Organization warns the coronavirus pandemic will get worse if countries do not stick to strict healthcare precautions. But the world body also says this needs to be done without shifting from lockdown to lockdown. VOA's Mariama Diallo reports.
As coronavirus infections surpass 13 million globally with more than 500,000 deaths, the World Health Organization is sounding a new alarm.
Let me be blunt. Too many countries are headed in the wrong direction.
The head of the world body insists without mandating basic outbreak control methods such as physical distancing, wearing masks, or staying home when sick, there's only one way for this pandemic to go.
It's going to get worse and worse.
His remarks come as WHO reported yet another worldwide record of more than 230,000 new cases in 24 hours on Sunday. 10 countries accounted for 80% of that total. More than half of the new confirmed cases came from the United States and Brazil.
Countries are losing gains made as proven measures to reduce risk are not implemented or followed. We're seeing this across the Americas, South Asia, and several countries in Africa.
South Africa accounts for most of the confirmed cases in Africa, with nearly 300,000 cases, including more than 4,000 deaths, according to the Africa Centers for Disease Control and Prevention. Amid a surge in hospitalizations, South African President Cyril Ramaphosa addressed the nation Sunday.
We are now recording well over 12,000 new cases every day. That is the equivalent of 500 new infections every hour of the day.
He reinstated a series of measures, including banning liquor sales to minimize hospitalization due to alcohol-related injuries and ordering a nighttime curfew. The South African president also made it mandatory for all residents to wear face masks when in public. In the U.S., several states are rolling back reopening plans. In California, Governor Gavin Newsom ordered bars and indoor restaurant dining to shut down statewide and also ordered churches, gyms, and hair salons to close in the hardest hit counties.
We're continuing to see hospitalizations rise in the state. We're continuing to see a modest increase in ICUs and number of beds represented by ICU patients throughout the state of California. And we continue to experience an increase in the rate of positivity here in the state of California.
A nail salon owner says the new order will not only affect him, but so many others.
If we don't make no money to pay the rent, the landlord suffers too. So everybody has a problem. Yeah, and then also we don't have income, and then our family, the problem too.
Something the WHO head touched on this week.
We need to reach a sustainable situation where we have adequate control of this virus without shutting down our lives entirely or lurching from lockdown to lockdown, which has a hugely detrimental impact on societies.
And the measures put in place in country by country so far have had varying degrees of success or failure. Mariama Diallo, VOA News, Washington.
As a medical student in Nigeria, Femi Adewuyi was known for his love of photography. But when the COVID-19 outbreak started, the newly graduated doctor found himself on the front line at the Yaba Isolation Center in Lagos. I spoke to Dr. Adewuyi about what his work entails.
So I volunteered to be able to document the pictures and to tell the behind-the-scenes stories of what happens in the hospitals. They were short of doctors, and I volunteered to assist with the care of the patients.
What has been the most challenging part of your work?
It's quite challenging when you have to break bad news to people. It's also challenging when sometimes you just don't have the amount of resources that you'd prefer to have.
So what kind of medicine are you using to treat your patients at this isolation center?
Okay, COVID-19 doesn't have a confirmed cure at the moment, so we typically give supportive therapy. So for those who have a fever, we give them paracetamol For those who are vomiting or having diarrhea, we treat that. For those who have difficulty in breathing, we place them on oxygen.
So in other words, patients don't exhibit the same symptoms?
There are a myriad of symptoms. Some even lose their sense of smell. Some lose their appetite for days. So we individualize the patient treatment. Is
there counseling for recovering patients and their families?
Yes, there's a psychosocial team that talk to doctors, talk to patients. They're even the ones that break the news to majority of the patient, because getting to know you're COVID-19 positive is a lot.
Is there any possibility of one who has recovered getting infected again?
There's a particular patient that we are treating right now that looks as if he's been reinfected, but we need to do the test and be sure it's a reinfection, not malaria or another respiratory infection like pneumonia.
How many patients are you able to accommodate, and how many are you as doctors caring for them?
Another wing of the isolation center has been opened, a 150-bedded facility. But previously, we've had about 25 doctors taking care of 100 patients. Another wing of the hospital has been donated by the private, a private consortium. So it's called CACOVID by Aliko Dangote, banks, and a few other private individuals. They built a 150-bedded facility. So we're expecting more doctors to come join in the fight.
Do doctors ever give up on a patient? Do you see a case where you say, I don't know what else to do?
So when I see such patients, I know the odds are against them, but I try to make sure that the last moments they spend with their family are something to remember.
What is it, doctor, that you would like people in Nigeria to know, people in the world to know about COVID-19 from your own perspective, having worked with people at the isolation center there in Lagos?
Okay, but there are still places in Nigeria where people don't believe that COVID-19 is real. I passed through the markets a week ago and 9 out of 10 people were not wearing face masks because a good number of people do not have respiratory challenges to COVID-19. A lot of them just have fever, generalized weakness, and a bit of malaise. A good number of people assume that it is malaria, but people who are asymptomatic and have these symptoms should not assume it's malaria.
Do you as medical doctors have sleepless nights about what you see every day?
A lot of people assume doctors do not have emotions. That's a false assumption. So there are times I have to take a break and just walk out and shed a tear before I come back and continue my work. But doctors have emotions. We have sleepless nights. We ask ourselves those hard questions that what could we have done better? And there are times we also suffer guilt.
So you do get together as doctors and talk about the challenges you're facing.
For instance, as we speak, one of my colleagues, a doctor, has been diagnosed COVID-19 positive. So she is in the isolation center. We're caring for her. It's a lot of emotional trauma that the healthcare workers also go through.
What makes you wake up every day and say, I'm going back there. I have to help these patients?
So if we all run away from fighting, if we all live in fear, then who would fight for us? So am I afraid of COVID-19? Am I afraid of getting infected? Yes, I am. But the fear doesn't paralyze me. It's COVID-19. So let's not leave the fight just to doctors or to the government. We can all find creative ways to make sure that we move forward and we win this battle.
Dr. Femi Adewuyi is a frontline doctor at the Yaba Isolation Center in Lagos. A top Tunisian official is quitting his post. Prime Minister Elias Fakhfakh stepped down Wednesday, triggering a political crisis as he tries to weather the economic fallout of the coronavirus pandemic. Fakhfakh presented his resignation to President Kais Saied, according to a government statement. Political sources told Reuters Saied asked for Fakhfakh's resignation as momentum grew in parliament to oust the prime minister over an alleged conflict of interest. A Nigerian technology entrepreneur who founded the Gokada ride-hailing app was found decapitated and dismembered in a luxury New York apartment late Tuesday, according to police. On Wednesday, police confirmed the death of Fahim Saleh and deemed it a homicide. Detectives found Saleh's torso inside the apartment near a power saw and later discovered his head and limbs sorted into plastic bags. Saleh's sister discovered the body Tuesday afternoon. We would like to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Coming up, the New York Philharmonic's first and only African-American principal player takes a stand for the Black Lives Matter movement. We'll be right back.
Hello, I'm Lynn Ormoudou, your VOA health correspondent. During the COVID-19 pandemic, the World Health Organization says there are currently no drugs licensed for the treatment or prevention of COVID-19, and there is no proof that hydroxychloroquine or any other drug can cure or prevent coronavirus. The misuse of hydroxychloroquine can cause serious side effects, illness, and even lead to death. For more information on COVID-19, visit who.int or contact your local or national health authorities.
Welcome back to Africa 54. Coronavirus lockdowns are impacting millions of people worldwide in different ways, economically, mentally, and emotionally. In Herat, Afghanistan, there are concerns about a possible rise in domestic violence. VOA's Halil Nurzai has this report, narrated by Bezan Hamdard.
Mandating stay-at-home orders may slow the spread of COVID-19, but it may be increasing domestic violence in Herat. Marzia Akbari, a psychologist, says some of the patients she treated pre-COVID have vanished and not come back.
We used to have one-on-one visits with women affected with violence in the hospital, but due to coronavirus, we lost contact. A number of women established communication through phone calls, but with some women, we even lost the option of calling them.
According to records in Herat province, the number of reported cases of violence decreased. However, the head of women's issues says there is a lag in reporting the cases.
We have recorded low numbers of cases among women in the past. We used to have about 10 cases, and now it is only 2 or 3 cases. The reason is the men are also staying at home, and they don't allow women to report violence.
Dr. Arif Jalaleh, head of the local hospital in Herat, says during a month of home restrictions due to coronavirus, there have been about 100 suicide attempts and reports of violence, and most of them linked to Herat city.
People are scared to come to the hospital. We used to have a high number of patients. We had 700 beds, but now it is only 300. We received 20 cases of women being beaten, and we had some 75 women who attempted suicide, either intentionally or they were poisoned.
Many experts believe that the stay-at-home orders have increased tensions at home. That, along with the economic stress of many businesses being closed, are the main reasons behind increasing violence against women during quarantine days. For Khalil Nurzai in Herat, Afghanistan, Bejan Hamdard, VOA News.
Seizing the moment, a new report by UNAIDS notes that progress made in the fight against HIV/AIDS could experience a setback due to the COVID-19 pandemic. In part 2 of Africa 54 health correspondent Lino Mudu's interview with UNAIDS Executive Director Winnie Byanyima, they discuss the impact of COVID-19 on the fight against HIV/AIDS and what can be done.
Can you elaborate on what kind of impact you are seeing with regards to how COVID-19 is affecting the fight against HIV/AIDS?
Oh, thank you so much for raising that. In particular for Africa, it is two colliding epidemics, and it is really it's going to have a devastating impact, and already is. First, we see that our countries were already weak economically, And that meant that they didn't have the resources to plow in health systems. Many countries had already been increasing their debt servicing at the cost of health. Health systems were already crumbling. Now with Corona, there is repurposing. This means that now there are disruption in services for HIV. This is dangerous. We have done an estimate and we found that if these disruptions continue for 6 months at a severe rate, as we are seeing in some countries, we might lose another 500,000 people in Africa in addition to what we are losing already. We might have reversals for children, new infections of children, taking us back to 10 years ago. So there is a danger there because of the dropping the ball on one epidemic to deal with another because of financial constraint. We have to try to keep two balls in the air. But secondly, we're seeing lockdowns. Lockdowns are hurting the vulnerable people who are the ones with HIV or vulnerable to HIV. Sex workers are being denied food and being blamed for transmitting the virus in my region of Eastern Africa because they are saying you are the ones sleeping with truck drivers. Gay men who are already criminalized are being arrested because of their lifestyle. Girls and women, we see the violence against them in the household increasing, more sexual violence. And this means there will be more infections, then more teenage pregnancies, maybe early marriage. We are also seeing that by not being in school and economies crashing, returning to school for girls will be a problem, for poor girls. So all these are risks that we are monitoring, and they are all adding to vulnerability to HIV and to inequalities widening in society.
A lot to tackle, a lot of risks there. So what can be done? I mean, it's so many things at the same time.
I would say that the most important thing is, one, at the global level, that the governments of the whole world see this as a global problem and approach it from a perspective of global solidarity. Where there are resources, help where there are none. Because we are in it together. No one is safe unless we are all safe. That's what our Secretary General Guterres has said, and is right. Two, it's important to be creative about how resources are used. Pull facilities together and fight on two fronts at the same time. Don't drop one. Three, decriminalize same-sex relationships. Honestly, this issue should be left to churches, mosques, and mullahs to be the ones to address it from their perspective of the churches. But governments should repeal those laws so that public services, health services, are available for everybody. Because the government is there to deliver to all citizens, not to judge and say you are not going to heaven, so you won't get your treatment. It's not the business of government to make those moral judgments. That's important. And then in the hospitals and clinics, keep a human rights perspective. You're there to deliver health rights to all, not to judge people, not to judge a girl because she wants a contraceptive. That's not your business. Offer it. Let her mother counsel her on other moral issues. Put the resources to the communities. They are the ones who know. Get communities to shape their own interventions. Give them money and let them work on it. Don't come with your own ideas, lock them up, deny them food, and then remember later that, oh, they're about to die. No, let them shape the response for themselves. Those are the key messages.
Winnie Byanyima, Executive Director of UNAIDS. Thank you so much for joining us today.
Thank you for having me.
That was Africa 54 health correspondent Lino Mudu speaking with UNAIDS Executive Director Winnie Byanyima. The New York Philharmonic's first and only African-American principal player took a stand of his own for the Black Lives Matter movement. In a black and white video posted on social media platforms, clarinetist Anthony McGill called on musicians to hashtag Take 2 Knees for Black Lives. Elena Wolf has this story, narrated by Anna Rice.
Okay, yeah, maybe I'll play a little bit.
Like many professional musicians, New York Philharmonic clarinetist Anthony McGill appreciates silence. The first and only African American in New York's Philharmonic, he was bothered by the sounds of protests outside his windows, but not because they broke the silence outside.
I'm still, like I said, I'm still locked down, like, as much as I know. I've been kind of watching it and paying attention to it, but I haven't protested since I was a young child. I thought, you know, everyone is at home, and I think we all saw what happened. A lot of us agree that a lot of this is wrong. And so why can't we say something about that? I think it's okay to.
The black and white video statement appeared on social media networks in June under the hashtag #TakeTwoKnees. There were no words, just music.
So that's where this came from, and I challenged anybody to also take 2 knees for justice, for righteousness, for beauty, for love, for connection, for humanity, all of these things that I think a lot of us believe in, and to do it in their way.
He says taking a knee can be a powerful gesture, but taking 2 is different.
And also, what I realized only after watching my video is that there are lots of different interpretations of what it could mean. The image of someone taking 2 knees, it could be an image of people kneeling down to pray. I mean, there's so many different interpretations, and I didn't think very specifically about any of them. At first, I wasn't going to use the clarinet at all. I was just going to I taped myself just falling down to 2 knees, you know, kind of helplessly.
McGill didn't think twice about what to play in his now viral video, America the Beautiful.
This is the kind of thing that we need to match our actions with our words, with the words of a song as beautiful as this, that we all know from the time we're kids. So that's why I played that. And I did my own little twist on it. And at a certain point, I made the tone a little bit minor, a little bit sad, a little bit haunting, just to say we have a lot of work to do still to live up to the ideals of our country and our nation.
Every day since McGill published the video, more and more new ones appear on YouTube under the hashtag he created. They are all filled with different types of music, but every single one is a stark contrast in black and white. For Elena Wolf in New York, Anna Rice, VOA News.
That's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thank you for watching.